I'd probably have grown up with my mum instead of being in care if there was such a thing as early help, because there was no one to intervene when it was needed.
When things are going really wrong, you need something to be done about it, and really quickly.
Early help is what it says on the tin. It's providing help early to children, young people and families, nipping problems in the bud when they arise, getting in early and giving the family as much support to sort things out for themselves as possible. We decided that this was one of the top priorities for the Safeguarding Board, but it's more than just about safeguarding children. For me, it's a public health issue. It's about making sure that children grow up happy and healthy, and that we do the very best that we can to give them the best start in life and the best childhood and adolescence that we possibly can.
By the time we got our family meeting sorted out, I didn't want to bring it all back up again.
When Professor Eileen Munro reviewed child protection arrangements in this country, which resulted in the new Working Together 2013 statutory framework, one of the things that she stressed was the importance of an early help system. What we wanted to do is create a system that's easy for people to use so that they can get help from their colleagues, and all of these different agencies, many of whom are represented on the Safeguarding Children Board, are there to help and support. That's their job.
Our frontline workers, so our health visitors and school nurses, come into contact with all children across Devon throughout their childhood, and therefore they play a really critical role in providing early help and support to young people and their family.
In adult mental health services, obviously we primarily work with the adult, but a lot of the times the adult's part of a wider context, part of the family, with children, and obviously they encounter stress with that, their children do, and really what we want is the best outcomes for everybody. So it's important that if we intervene earlier, it'll be much more effective for all concerned.
I work with adults with a learning disability, and early help will be a real bonus, drawing together all the professionals so that parents with a learning disability are able to parent their child from birth through the teenage years right the way up to adulthood.
Within midwifery services, I think we have the opportunity to identify very early within a woman's pregnancy that she may and her family may need extra support, and to have everything in place for when that baby's born.
Sometimes services don't talk to each other, and then you're blamed for doing something wrong because of lack of communication.
Our new early help system helps support them to do their job and help other professionals and practitioners do their job, and therefore prevent children going through to a position where they are at a safeguarding risk, that they reach those statutory levels for intervention.
I was unsure of who I was meant to be speaking to, which often meant I didn't voice my views.
Everything we do around service planning, service strategy should involve users, and children and young people are very special users, and we need to make sure that what we're doing fits in around their lives. It's about using preventive measures to stop things escalating into very complex, expensive situations.
Had I known what I could have had before things came to a crisis, I think I would have asked for more help.
We will know if we've succeeded in Devon if we have children who we can see are safe, because we get a really good use of the early help system, and we know that the assessments and the plans that are being put together for children and families are really high quality, really consistent, and we can see outcomes for children and families that are really positive.